Hi, my name is Dimple Rayani. I'm one of the doctors here at Balfour Dental. Sleep apnea is basically an obstruction or it's a narrowing of the airway space. And so what happens at nighttime, specifically when people sleep, they lay down, gravity takes effect, lower jaw drops back, and the tongue obstructs the airway. And so what sleep apnea is that you're stopped breathing during the nighttime because there's this obstruction that's happening. And those amounts of times that you stop breathing add up to then a lack of oxygen throughout the night, and over a period of years can decrease your lifespan by 10 years sometimes. Sleep apnea for many patients is undetectable because normally when people are sleeping, their partners are still sleeping and they don't hear them stop breathing at nighttime. So it's harder to detect, and also snoring not necessarily is a form of sleep apnea, but it can be a precursor or it could be an indicator of it. The only way to really detect sleep apnea is to have an overnight sleep study, either in a facility or with an ambulatory device. Some medical insurances dictate that they only do the at-home ones, which are not as diagnostic as doing an in-facility overnight sleep study. The in-facility overnight sleep studies, you have to go to a sleep center and they'll monitor you overnight, but it's not just measuring your oxygen saturation, which is what the overnight at-home one does, but it also measures if you are waking up. How many times are you waking up? How many times do you stop breathing? How many times are you moving when you're sleeping? These are all contributory to sleep apnea. Once we review the sleep study, then we'll go ahead and talk to the patient, let them know what devices we're going to be using, how the devices are going to work. We initially start by scanning the patient, taking some scans of their upper and lower, and fabricating a device based on their sleep apnea starting point. Then from that point, we go ahead and titrate that device every few nights until the patient's symptoms are being relieved. Then we go ahead and send them back to the sleep center for a second sleep study, which should show an improvement or complete cure of the sleep apnea, especially if it's slight sleep apnea or moderate sleep apnea. So if you are a patient that feels that you're suffering from sleep apnea, please call our office, Balfour Dental, for a complimentary consultation. We will be happy to go over what specific treatment plan options we have, what may be going on, direct you in the right area for the testing, and guide you through the process.